News Radio 700 WLW.
And Jace, when you go to the doctor, and I'm sure you do on a regular basis.
Oh, yeah, every 6 months, Ed.
When was the last time you went to the doctor? Honest to God.
4 years, 3 years. Yeah, probably. Not good.
Yeah, well, you're fine. when you
Until I'm not.
When you fall down one day and go, what's wrong?
Right. I'm lightheaded.
But now, obviously, things are changing. We live in a crazy new world, and AI, that's all you hear about. AI this, AI that. And, of course, you're going to hear about it getting involved in medicine.
Oh, yeah. It's going to, yeah.
Now, how much should it be involved? Now, I like the idea of computers breaking down, give them take all the test results, feed it into that thing, and if it spits out, goes, this sounds exactly like this, okay, I can accept that, as opposed to your doctor who goes, God, I got nothing. This sounds, it could be this, it could be that. But at the same time, don't you trust that it could be this, could be that, as opposed to the computer going, well, there's a 79% chance this is what it is.
Yeah.
There's a 49% chance that it could also be this. There's a 30% chance it could be this, and on down the road. Obviously, that adds up to way more than 100%, but you know what I'm saying.
Yes.
I don't know what I want, and also where does liability come into play and all that kind of thing, and that's the reason we have this fella right here to break it down for us. He is Chris Mathew, the Chief Growth Officer with Sniffle. They are the world's first AI-driven virtual care ecosystem. Chris, welcome to the program.
Howdy. Good afternoon, guys.
So Chris, you heard what we were saying there. First off, let's get into that liability issue. If your doctor uses an AI, whatever, co-worker, co-doctor, AI consultant, let's put it that way, and what kind of liability issues are we talking if the computer gets it wrong?
So, guys, the way to look at AI, it's a tool for a physician to use in helping her take care of her patients. It's a tool. So when my physician uses a stethoscope or uses a lab test or uses an MRI machine, those tools are not liable. It's the physician using those tools that's liable.
Gotcha.
So the liability will always remain with the physician because no tool, including AI, should usurp the expertise of a physician. That's our stance.
Okay. So this has all been tried and tested, the AI, the robo-doctor, so to speak. And if so, can you explain what's been found and how that's all what's happened there?
Yeah. Guys, it's still really early on, right? Like, again, I just mentioned the stethoscope, lab test, MRI. When those things came out, people were very skeptical, but now they're part of just everyday practice of medicine. AI is going to get there. We're just extremely early on. Eddie, you were mentioning percentages like, if it's 79% right or 45% right or 39% right, I'll tell you right now, for my family, none of those percentages are good enough. And if you're not more accurate than 90+%, then it's just a coin toss, in my opinion. Mm-hmm. So AI is early on. But when it comes to recalling information, think about what a physician goes through to become a doctor. You know how many years of training it takes? It's undergraduate, plus 4 years of med school, plus 3 years of residency, plus fellowships if they choose to be a specialist. That amount of information to be absorbed, it's really beneficial to use AI to help recall that information, to help use it to assess and validate, this is a acute bacterial infection. Okay, yes, these are the indicators for that. It's still the physician's relationship with that patient and their empathy to that patient and that continuity of care in that relationship that really allows the right diagnosis to be applied. But AI can be something to help that physician recall that incredible amount of information that they all have to study and learn, but make it now easily available at their fingertips.
And
like what the internet does for all of us.
and Chris Mathew is our guest. And Chris, I laughed there because my doctor, he has since retired. But is this kind of thing? And I guess it's generational because my doctor was more or less about the same age as me. And so he used to have to peck in all this stuff into his laptop as opposed to making notes to himself and breaking it down later on. And he would have to plug all the right holes before he could. I mean, in other words, a checkup that would have lasted maybe 20 minutes with me was lasting 45 minutes simply because he go, hold on, this just screwed up. I'll be right back. And all that type of thing. Is it too intrusive or is it needed? I mean, I guess it is to keep accurate track of everything that's happening.
You're right, Eddie. When you think about AI, don't just think about it when it comes to the diagnosing part. Think about AI being able to take notes for the doctor so that your doctor could be more focused on actually hearing what you are saying, looking at you eye to eye, versus having to type everything into their laptop. Because the reality is so much of all of that technical process that physicians have to do today is for their electronic medical records. Because if they don't do that, then they don't get reimbursed by the insurance companies. So what if we allowed tech and AI to be able to do all of that grunt work and that heavy lifting so that the physician can be more focused on you, the patient? That's where AI can really help, right? Yes, in the diagnosis side as well. Jason, if you haven't visited the doctor in 4 years, the great news is Sniffle's got a tool for you. It's called an iAgnosis. It's an AI-derived diagnosis. It's built upon 14 million patient visits that have taken place. They've been loaded into our machine learning language protocol. Download the app, and you can go find out what's happening in real time with a 95% accuracy of what's happening in your situation.
Just by looking in like this app, like this app can like just look. I could do it's like a face.
No, it's not going to be that.
Face ID or okay.
It's going to be you saying, for example, I have a headache. Or it's going to say, you say, I have a stomach ache. But it's going to then also ask, what's your family medical history? And then what's your lifestyle? And then you're going to put in, I have a stomach ache. Because it's built upon 14 million patient visits, and then we add on your thumbprint, right? Your family medical history, your lifestyle, and your chief complaint or your first symptom. When it leads you through this medical interview, it's going to ask you these different questions. And how you answer that question, Jason, is going to be very different than what Eddie says, because Eddie's family history is different than yours. And the AI knows that, and so it asks you different questions. And because of that, the returning result of the differential that comes back has a 95% accuracy rating. Now, at that point, that's your chance to say, hey, doc, this is what's going on. Can you validate this? And the physician takes their expertise from there. Or the AI, the digital triage in our app may say, hey, Jason, with certainty, you have appendicitis, and you need to quickly and safely get yourself to the emergency room. But at that point, the ball's in your court. And you, as the patient, get to be in control and not leaning on WebMD or Dr. Google like so many of us have done in the past.
Right. And Chris, to hear you you talk about Sniffle like that, that's great, because I was going to ask you how Sniffle stacks up against WebMD, because I can tell you how many times, and I guarantee you that a bunch of people listening to us right now have said, I'm not going to go to my doctor over this. I'll just look it up online. You go to WebMD and you go, holy crap, I think I need a heart transplant, and really you have heartburn.
It's just indigestion. You do not stop YouTubing how to do a heart transplant. You are not qualified.
Right. I have
nor are you in need. Yeah, exactly. Nor are you in need. Listen, that's the problem. WebMD and Google, these are incredible resources, but the problem is they're not medically curated. And this is medically curated AI. This is, again, unique for Jason and Eddie and your loved ones. That is where technology is taking us. And if we can lean into that and help tech, listen, right now, you all have heard of the concept of physician burnout And at least during the pandemic, we all heard
Big
every
time.
And the
clinical
physician shortage too, right?
big time.
Yeah.
Massive shortage, and they're all exiting at a massive level because it's such a beating to be such an empathetic caretaker for all of us, and we need them. We need them in a huge way. The problem with so much of what's robbing joy of clinicians is the administrative burdens that are put on providers today, physicians, clinicians, nurses. Well, what if we were to use AI and advanced tech to help alleviate that? Could we return joy back to the clinical workforce? Our stance at Sniffle is absolutely. Not only can we must. We have to do this because we have got to take back healthcare. Physicians and patients deserve better healthcare. They deserve better care, bigger picture. That's what Sniffle's trying to stand for, and these tools will help us get there. I know it's early, but these things will make a huge impact, like all of the advancements in medicine have over the last 100 years.
Well, you know what, Chris? Fascinating stuff, man. Thanks so much. Chris is the Chief Operating Growth Officer with Sniffle, sniffle.com. Chris Mathew, thank you so much.
My pleasure, guys. Thank you.
Thank you.